nipple discharge or breast discharge without pregnancy. You've been noticing that you've been leaking, your nipple has been leaking breast milk or fluids, and you know you're not pregnant. Okay, could this be a sign of breast cancer? Could this be there's a problem? Even most men actually think that a lady lactating, means that either she has an infection, or she just had an abortion, or she has given birth. Okay, I'm going to take away those myths right now. I'm going to tell you about 7 reasons why you may produce breast milk, okay, even when you are not pregnant. And then the most important thing, which is what you should do, or treatment. My name is Nurse Merit. I'm a nephrology nurse. If this is your first time here, please make sure you like this video and also hit the notification button so that you can always get me when I make videos. I'm a nephrology nurse, basically dialysis, kidney, everything about kidney is my specialty. So we'll talk about kidney here, we'll talk about women's health, we'll talk about how to take care of your organs and prevention of illness, not just treatment. We'll talk about prevention, so that even if you don't have anything, you can you can keep your body in good maintenance, okay, by the tips that this channel provides. Now, the number one cause why this happens is usually high prolactin. Okay, prolactin is the hormone that is secreted. When it's secreted in the brain, it tells your body to start lactating milk, okay, when you've given birth. So whenever this hormone is high, it can make the lady start lactating without being pregnant. Now, what we're going to be discussing are the conditions that can make these hormones start lactating, because they will just start lactating. Something is making them start lactating. Usually they only start lactating after childbirth. Even when you're pregnant, gradually stimulation occurs when you give birth and your baby starts sucking your nipple, they take off. But however, they just start on their own. You're not pregnant, nothing happened. What is the cause? Now, having known about the number one cause, number 2 is excessive stimulation of your nipple. Yes, this can be in the sense of suckling your nipple, your partner suckling your nipple, or romance, doing sex, even pressing, stimulating it, even workouts. Women that wear workout bra, you always jump, once, or you're wearing your normal clothes, the chafing, your skin is chafing on your bra. It can stimulate. For people that have, excessive stimulation can make you breast milk, this prolactin to be stimulated and make breast milk come out. That's number 2. Number 3 is stress. Excess stress, chronic excess stress can cause this. It can trigger that hormones, prolactin, to stimulate and make you lactate even when you are not pregnant. Okay, the next thing that can cause this is hormonal imbalance. Please, if you've not watched that video on hormonal imbalance, I beg you to watch it. Locate the video here on my YouTube channel. Watch the causes of hormonal imbalance and how to treat hormonal imbalance. Now, this prolactin, when it's a hormone, right? It's imbalance. It's produced in excessive amounts. It makes you start lactating. So hormonal imbalance, some of your hormones are imbalanced. This can make you lactate. Usually this is one of the main reasons for that. Okay, the next thing that can cause this is some herbal concoction, that you take. Okay, this can be seen in people that cooks cloves to drink. In as much as it is healthy and does some of the things you thought you thinking, some of these things have things that stimulate you to lactate. Not just that, some herbal concoction people sell for infection and stuff. This can, most of them have some, research has shown that most of them have some things that make hyperstimulation of the hormone prolactin, and then you start lactating. Okay, the next thing that can cause this is some medications, for instance, some antipsychotic medication, blood pressure medication, diabetes medication, kidney medication, some medications, generally hormonal medications. Okay, people that take post pills, this can throw off your hormones, imbalance your hormone, especially when you're taking post pill almost every month. This will make you lactate. Please stop that. Okay, there are better ways of preventing pregnancy. I've done that video, but I think it's down on natural ways of preventing pregnancy. I'm going to do it again, but locate it. I've done that videos that is very well detailed, so locate it. Natural ways of preventing pregnancy instead of taking post pill and all. Okay, now and also you can learn how to calculate your ovulation. The videos are here. Signs that you're not ovulating, the videos are here. Locate all of those videos and what to do when you're not ovulating. The next thing that can cause this is brain tumor or thyroid tumor, because this thyroid gland that produces this thing, when there's a tumor, they're pressing on the gland, it makes hyper stimulation, like the stimulation of this hormone. Or this person had brain damage, or you had an accident or something that affected the brain, the thyroid gland, okay, or there is a tumor. So please be aware of this. This is also one of the hyperprolactinemia. This is one of the causes of this lactating when you're not pregnant. Okay, the next thing that can cause this is infection, untreated infections like pelvic inflammatory disease. Okay, can cause this. Gonorrhea, untreated infection can cause this. Breast infections too can cause this. Okay, however, there are ways you will know. Your nipple will start paining you start seeing injuries, start spilling. Okay, so please be aware of this. The next thing that can cause this is breast cancer, which is very rare, but your doctor may notice the way I taught us how to do breast self-examination. You may notice that as you're palpating, you start noticing lumps under your armpits. Your breasts are not the same. The nipples are like this. All those signs I showed us and how you notice all of those things. Please rush to the hospital, okay? And anything you see that the nipple is, the discharge is either greenish, red, or brownish, dark, please go to the hospital, okay? Having known about this, let's talk about how to deal with this. Remember, let me do a recap. I said excessive breast stimulation, high prolactin, injury to the thyroid gland. What else? Yeah, the next one I forgot to mention is pregnancy. Okay, if you're pregnant, it can cause this. If you've had recently had a miscarriage, okay, it can cause it. However, after your miscarriage, you're supposed to normalize. After breastfeeding, after giving birth and you finish your breastfeeding, you stopped your child from breastfeeding. After 1 year, everything is supposed to be okay. After breastfeeding for 1 year, it's supposed to be okay. It's supposed to stop, seal, as long as you're not breastfeeding that child. Okay, so pregnancy can cause this. So pregnancy, ectopic pregnancy, miscarriage, all this can cause infections. All this can cause this, but they are not the number one thing. Overstimulation can also cause this. Now, what do you do? The number one thing to do is, first of all, please, you are expecting me to tell you the drugs to take. I can't tell you the drugs to take. Not that I don't know the drugs, but I don't know what is causing yours. It could be hormonal imbalance. There are some other hormones that might be imbalanced aside from the prolactin. It could be stress. It could be you had miscarriage. It could be thyroid issues. It could be polycystic ovarian syndrome. It could be anything. So what you need to do, I know the next thing people take is this drug they prescribe for you, cabergoline. I can't prescribe this drug for you because there are contraindication. There are people that shouldn't take it, which I don't know if you're one of them. So what you need to do is please go and see a gynecologist. I didn't say go and see a normal doctor. See a gynecologist. If they've prescribed drugs for you before, you let your doctor know the drugs it was. See a gynecologist. He will take your history, do some certain investigation, scan some certain investigation, find out what is the actual cause. And trust me, at the end of the day, you will be better. And you will know. Don't joke with your body. Don't go and ask anybody you don't know to take drug. Maybe your friend took and has stopped. You don't joke with your body. This body is one. So please, if you notice anything insignificant with your body, please go and see a doctor. However, this thing may be insignificant. It starts and then it stops. It's not like it's very insignificant, okay? So that's all about it. Please like this video, share, and follow for more.